Although some may consider marijuana use to be harmful, you must realize that normal recreational cannabis users and those who misuse the drug are quite different. Despite being prohibited in some states, most jurisdictions allow the medical use of marijuana. Cannabis can be used safely and has health benefits, but it also has some potential effects. This video will cover what happens to your body after 1 month of cannabis use. First off, welcome to our channel. Kindly subscribe to our channel and turn on notifications to get updates on our posts. The chemicals in marijuana have effects on the body as well as on the mind. It has the potential to be addictive and could sometimes be bad for some people's health. Here are some effects of marijuana use after a month period. For people with medical conditions, it may lessen their pain and other symptoms. Most jurisdictions have some kind of medical marijuana law, and adult marijuana use is now allowed in almost half the country. It's been challenging to research marijuana impacts on people because of the federal government's prohibition of it. The most prevalent use of medical marijuana is to treat chronic pain, and the limited studies suggest that it may also have other benefits. It also assists with multiple sclerosis-related muscular spasms or stiffness. And for those with arthritis, sleep apnea, nervousness, appetite loss, and seizures from epilepsy, it improves these issues. You might also feel more hungry. It reverses weight loss brought on by some illnesses. Regular pot users frequently report that it increases their appetite to eat. This is known as the munchies. According to some studies, this could aid in weight growth for those suffering from serious medical conditions like AIDS or other diseases, although experts are still investigating this further and its safety. Your thoughts, however, might become distorted. Your perception and feelings may be distorted by marijuana. Depending on factors like how strong your marijuana was, how you smoked it, and how much marijuana you've used, the effects may vary. Your perceptions might become more heightened. Sounds may also seem louder, and colors may appear more vibrant. Your perception of time may be affected. Regular skills may be affected. Things like driving may become more hazardous, and you may tend to take more risks. So, what happens after quitting marijuana use? Cannabis use can be difficult to stop because your body and brain gets used to its presence. You run the risk of experiencing cannabis withdrawal symptoms like poor sleep, irritability, and mood swings, poor appetite, restlessness, and strong desires for more cannabis as your brain chemistry shifts out of equilibrium. Luckily, those only persist for a short period after you stop. Even though those times may be difficult, quitting weed use may be the only way to prevent the risk of it affecting your personality. You can reduce your risks by selecting a product that contains more CBD than THC. The likelihood of experiencing negative effects and increased degrees of impairment increases with the product's THC concentration. Some of the impacts of THC are reportedly diminished by CBD. Overall, if you are successful and do not experience any negative impacts from marijuana use, you can continue to use it safely for either therapeutic or recreational reasons. If you are negatively affected, you must stop temporarily or consult your doctor about a rehabilitation strategy. Cannabis has a reputation as a risk-free substance that can ease physical and psychological ailments. But marijuana also has the potential to cause harm, just like so many other drugs. Cannabis can certainly affect you as a person, depending on how much, how, and why you use it. Safe use is always recommended to keep good health. That's all for now. Thanks for watching. Remember to check our profile for updates on getting a medical marijuana card to take advantage of California's medical dispensaries and delivery systems.